Heidi Mercer here again to continue our series on diabetes education, considering the use of insulin and keeping it simple. Today, the topic of discussion will be low blood sugar because people on insulin have to deal with it. So let's start out by talking about what is low blood sugar. Well, anyone who takes insulin is at risk for developing hypoglycemia, which is the long word for low blood sugar. There's also a pill called a sulfonylurea that can cause low blood sugar. I call them the G pills. As you can see, they all start with the letter G, glyburide, glipizide, or glimepiride. And these medications are usually used for type 2 diabetes. Now, when you're considering how to keep the blood sugars in range and as stable as possible, there are three main things every day that are intertwined that affect your blood sugar the most. And that is food, activity, and of course medications, which what we're talking about mainly here is insulin. Now, when these three things are well balanced, so you've kind of got a routine down and you know how much food you should have, how much activity you should have, and how much insulin it takes to take care of that, then you're more likely to have your blood sugar stay in range. Just wanted to list a few other things that can also affect the blood sugar. Illness and stress and hormones and some medications that are used to treat other conditions can also affect the blood sugar, and most of the time they make it go higher, not lower. So the definitions of low blood sugar. Severe hypoglycemia is defined as a blood sugar that's so low that you need help fixing it. So you're too confused or lethargic or maybe even pass out, and you need somebody else to provide the treatment for you. This number can vary a lot. Some people don't feel these symptoms until they're, 20 or 30. That's unusual. Some people start feeling symptoms in their 80s and 70s. But anyway, there is no number associated with it. It's just the point where the person gets too confused to help themselves. Otherwise, the documented symptomatic hypoglycemia is defined when that blood sugar hits 70 milligrams per deciliter or less and is having symptoms of low blood sugar. And then there is the asymptomatic hypoglycemia, which means, again, the blood sugar is less than 70, but the person is not having any symptoms. They're just totally not aware that they're having a low blood sugar. This most often occurs in someone that's had diabetes for a long time and has had so many low blood sugars that basically their body is just kind of tired and doesn't warn the person anymore with symptoms. So what are the symptoms? You need to recognize low blood sugar. That's an important part of staying safe, is learning what the symptoms are and not ignoring them. So the most common symptoms are the two first listed, the sweaty or clamminess. And this is not like it's 95 degrees out sweaty. It's not hot. There's no other excuse for why you're clammy and starting to sweat. And a shakiness is very common too. This usually is accompanied with a nervous feeling. Sometimes you can feel the heart rush. Many times people are very hungry. Their vision can change, feel weak. The tongue especially can go a little bit tingly. You can feel lightheaded or dizzy. So if you have these symptoms on any kind of a regular basis, you certainly should be testing your blood or checking your CGM. But just don't ignore it. Be able to report these symptoms and test your blood sugar to see if what's actually happening is you're having low blood sugars. If you wait, the later symptoms are what we're trying to avoid, and that's the severe symptoms we were talking about previously. As if you think, oh, I'm just a little bit dizzy, but I just have one more project to finish and then I'll take care of it. It can progress rapidly to a point where you're not coordinated enough, or you're too confused, or you fall asleep and you're not able to treat. And also, you've all heard of probably people that have had seizures from low blood sugar, and you can eventually pass out. So the point is, you don't want to let it get this far. So what do? You're having the symptoms, you test your blood sugar, and you're less than 70. Or you're checking your blood sugar, or you're looking at your continuous glucose monitor, or the alarm is going off. Don't ignore it. Like I said, it can get worse. If the blood sugar is indeed less than 70, we have that rule of 15s that we follow. And, this is all a live and learn situation. This is pretty much where we start when you're learning how to treat low blood sugar. So most people that are less than 70 but still above 50 will be fine with 15 grams of rapid-acting carbohydrate. And then I've listed some suggestions of what equals 15 grams of rapid-acting carbohydrate. So you see how they're all pure carb. There isn't anything listed here with fat like peanut butter or chocolate, because those foods slow absorption of the carb. So I'm a fan of the glucose tabs and the glucose products out there, either the gel. The gel's kind of icky, but they have a shot too, just a liquid shot where you get 15 grams. I like it because it's measured and you try it and you try to be confident to wait for it to work. 4 ounces of fruit juice or soda works very similarly. If you're at home and you can get a tablespoon of honey or maple syrup or sugar, sugar's kind of hard to eat. And then small pieces of sugar candy, but you got to chew them up. You got to get 15 grams in, and sometimes that's a challenge. Or if you're going for the healthier type with a little bit of fiber, 2 tablespoons of raisin is about 15 grams worth of sugar. So the whole idea of the rule of 15s is to wait for it to work. These types of carbs are absorbed very rapidly, and sometimes it can be nerve-wracking to wait. Definitely, if you are getting worse, you don't need to wait. If you have a CGM, it's nice because you can watch and see what's happening with your blood sugar. But anyway, retest after 15 minutes if you've made it that long, and then if it's still below 70, do another 15 grams. This whole procedure is to try to prevent that common overtreatment that sends you high and buys you a ticket to that roller coaster where now you're high and you take more insulin and you go low, and then you take too much carb and you go high. We're trying to avoid that. Now, I will also say each person will learn their own patterns. And maybe you already know that. Maybe you're already thinking, I know I need at least 30 grams. So, that if you've learned that that's what you need to do, but the whole idea is to be careful to not overtreat. I know it's really hard because that hunger that happens, I've been told by many people that you open up the refrigerator and you want to eat everything in it, that it's really hard to control. That's why it's nice to have a plan where you've measured out 15 grams so that you're well aware of how much carb you're consuming, and don't look back and say, wow, I just had 100 grams of carb. So you retest and you repeat this treatment every 15 minutes until you are above 70. Again, I'll say you shouldn't choose food that has fiber, protein, or fat. This will delay absorption. After you fix the low blood sugar, it's okay to have a little treat like this. Like some people are very sad to hear that chocolate isn't a good idea, but it isn't. So as I mentioned already, it's a good idea to use the commercial glucose products so you can keep track of how much glucose is consumed. Now, it's another thing that's nice about those products is you can carry them easily with you in your pocket or your purse, put them in the car, on your bedside table. They can be kind of everywhere, so you never have to look very far, because low blood sugar can surprise you. So you just want to be ready. We also already talked about overtreating hypoglycemia can cause post-treatment hyperglycemia. So it's important to not keep eating until the symptoms disappear. It's important to keep eating until the blood sugar gets above 70. And if you are in a position where you're unable or unwilling to treat low blood sugar, you will need assistance. So this means it's a good idea to have the people that you're with closely on a day-to-day basis know how to recognize this and help you out too. If you're able to swallow, they can help you. They can run and get your soda or your glucose tabs. If you're already kind of gagging, it's possible to just have honey or syrup or jelly and rub it on the gums. This is a little bit dangerous, so be careful. If the person is definitely unable to swallow and has Baqsimi is a nasal spray that is a medication called glucagon Glucagon is a copy of the hormone that causes our liver to release sugar. So when you give yourself a squirt or a shot of glucagon, it sends a message, an emergency message to the liver to release sugar. So if you have the bacsemia, this can actually still be taken by a person that's having trouble swallowing, or can be given by someone that knows how to give it if the person's having trouble. Otherwise, injectable glucagon can also be given by a trained person, and this is a good idea to have at home because a lot of times, of course, you should call 911 if it's this severe, but a lot of times the person is waking up and pretty much feeling okay by the time the paramedics get there. So, of course, if the person is unconscious, you should call 911, but I would do it even if they can't swallow because you just don't know where this is going. Know also that glucagon can cause nausea and vomiting, so especially if the patient is unconscious, make sure after you give the shot that you turn them on their side in case they wake up and vomit. You don't want them to swallow their vomit. And then after the event, after the low blood sugar, the hormones are going to kind of be swinging, so blood sugar levels should be monitored carefully, either using the meter or the CGM to watch if they're going to drop again, like if there was some long-term insulin is too strong. There could be several drops before things settle down. Or you also might want to know if the overtreatment did occur, or if your liver automatically shot sugar. It's called reactive hyperglycemia. If the liver shot sugar into your blood, you may have gotten quite an elevated blood sugar just from having a low. So as the individual is able to swallow, oral carbohydrates can be offered. I would again start with the fluids just in case they pass out again. But this is the time they could have a little bit of juice or milk. And then as you're like, okay, I'm swallowing, I'm talking, I'm feeling good, probably should have at least a snack, if not a small meal, to prevent recurrence. So this is this small meal. Now you can have that peanut butter, that half a peanut butter sandwich or peanut butter crackers, something like that to level out the blood sugars again. Just remember when you're being prepared for low blood sugar, that glucagon does require a prescription and it does expire. So this prescription must be obtained from the provider, and the provider or the provider staff can also show the person and the family members how to use it. Glucagon should be kept in the home at all times just because it's very helpful in these severe hypoglycemia problems. People also with diabetes should wear a medical alert bracelet or necklace or some form of identification that strangers would be able to identify what the problem is, especially, if you're out and about and someone's called the paramedics and the paramedics see one of these, they know what to do right away to bring you back. So your family, friends, and coworkers should all be trained in recognizing low blood sugar and in treating low blood sugar, including the use of glucagon. Of course, we don't want this to happen very often. If you've already had it happen, it's a pretty lousy feeling and it's not something people want. So the best method for preventing it is to, as we mentioned in the very beginning, balance out your food, activity, and medication, with a plan that you found has worked for you. So this requires matching your food choices and your activity with medication. If the doses that you're taking at mealtime are set, like your doctor's told you take 3 units at breakfast, 4 units at lunch, and something like that, then you have to have about the same amount of food at every meal because you want that insulin to match your food. Some people use a carb ratio. If flexibility at meal time is desired, if some days they're like, I don't always want to have that meal at breakfast. Some days I want this 2-carb meal. Some days I want a 5-carb meal. You can learn to adjust your insulin to match that food. Also, you need to think about what to do if your activity changes, if it's not your normal daily activity. So if you're going out for a walk in the afternoon and you already had your lunch and your insulin, maybe you want to have a piece of fruit before you go and always slip something in your pocket. Or maybe you knew you were going to do it before lunch and you take a little less insulin, 1 or 2 units less, depending on how big a dose you usually take. So I call it having some free carb at lunch. Take a little less insulin so that you are ready to prevent lows. If you're having a lot of low blood sugar, let your provider know, because it's not something that we expect people just to live with. It's pretty miserable. So if that's happening regularly, we need to figure out if your insulin dosing needs to be changed, or carb counting needs to improve, or what needs to happen so that your incidence of low blood sugar is not too often. So that's it on low blood sugar, on recognizing and treating and preventing low blood sugar. So leave a comment and give me a rating and let me know what I can do to improve. And I will be recording part 3B soon. We already had part 3A, which was using insulin pens. The next video will be on using a syringe and vial, as some people still do. So that's it for today. Hope you have a good rest of the day.